Hello everybody. I know it is crazy late. Let's put a filter on. It is crazy late, and but this video is going to be recorded for anybody that wants to watch afterwards. So I have decided to start these live videos talking to you guys a little bit more about what I do. I've made some notes and hopefully I can stay on track and explain to you guys what myofunctional therapy is. That's the topic of today. If you have any questions, even though this video is not live anymore, if you have any questions, please just write in the comments below and I'll be happy to answer them. Hey Amanda, thank you guys for joining. It's so late, you know, kids are asleep, Zach's asleep, and this is the time that I have to do this. So I'm gonna be looking down a lot on my notes until I get really good at this. So hopefully I can explain to you guys a little bit more about what I do. So here we go. It's about the post that I made this morning. I get asked this a lot. What is myofunctional therapy? Most people have never heard of it. And myofunctional therapy is kind of a new emerging field in the United States. Who can do this? Registered dental hygienist and speech pathologists, mainly. Some other professions also go into this, but it's mainly dental hygienists and speech pathologists. Speech pathologists have been doing myofunctional therapy for several years. In Brazil, that's where one of the biggest places in myofunctional therapy research is Brazil, where I'm from, if you guys don't know me. They have actually an extra 500-hour course after you graduate over there to learn myofunctional therapy. So what is myofunctional therapy? It consists of therapeutic exercises to restore optimal muscle function. So our muscles work in harmony. One needs the other one to complete certain tasks. And if one of them is not working very well for several different reasons, then something happens that's called a compensation. Our bodies are very intelligent and they compensate if something doesn't go right, because you still need to have that function. So you still need to breathe, you still need to swallow. So it's gonna find a way to do it. Well, if a muscle is not working properly, then the other ones are going to take all the load of that muscle, and you might have issues that come with that. Okay, and I'll get a little bit more into it in a minute. So let's see. The compensation occurs, our body, yes. Sorry about that, let's see. Okay, so let's talk about what causes compensation. So it's a break in the pattern. Muscles have patterns depending on the tasks that we're doing. So for breathing, there's patterns that happen. For talking, there's patterns that happen, which of course, if somebody has a speech issue, they have to go to a speech pathologist. A dental hygienist practicing myofunctional therapy can never work on speech. We don't know, we're not trained on it. Only speech pathologists can do that. And myofunctional therapy is not speech therapy, okay? It's a little bit different. We are mainly working on function. The function of the tongue, the function of the muscles of the orofacial complex, okay? So what can happen to break a normal pattern in muscle movement? Several things can happen. So if you have surgery to the head and neck, if you have any type of trauma, including birth trauma, that can affect your muscle pattern. Oral habits, thumb sucking, pacifier, sippy cups. Believe it or not, sippy cups can affect your muscle function negatively. What else? Airway issues. So if you cannot breathe right, if your tonsils are swollen, if your adenoids are swollen, if you have crazy allergies, that's going to affect the way that you breathe. You have something inside your nose called turbinates. They're little spongy. There's 3 on each side in the entrance. They're these little sponges over there that swell up if they encounter an allergen. if they swell up, they fill up with blood, all of a sudden your nose gets stuffed. And I don't know if you've ever noticed this, but sometimes when I go to sleep, and it used to be a lot worse, but if you lay on one side and then, like if you lay on this side, this one gets stuffy. And then you lay on the other side and this one will get stuffy. And I always thought it was, in my head for some reason, it was mucus going from one side to the other. And it's not. It is blood going from these turbinates to the other, just going from back and forth. And there is actually some breathing exercises that we can teach our patients to help unclog your nose. So we pretty much teach your nose that you need to be used. And the more you use your nose, the better you're going to be able to breathe. The second you open your mouth to breathe, the turbinates will swell up. That's usually another thing that happens. See, I love to go on tangents and get off topic. That's why I really need my notes. Also, something that can cause a compensation is a disturbance or incorrect swallowing development. So whenever we're babies, we have a swallowing pattern called the infantile swallowing, where your tongue goes back and forth in order for you to swallow. And eventually that is going to become a mature swallowing, where the tip of the tongue stays behind your front teeth and the rest of the tongue goes like this. Okay, that's how you swallow afterwards. If for some reason, so if it's an oral habit or trauma, or if you're sick all the time, for some reason something happens that prevents you going from infantile swallowing to mature swallowing, you're gonna keep swallowing like this. In the dental world, we call that a tongue thrust. It can also be called reverse swallow, but it's an atypical swallowing. That's not how you're supposed to be swallowing. After you go through your infant years, you're supposed to be swallowing with your tongue, tip of the tongue up, and the rest of the tongue goes like this. If you've ever seen a child have difficulty swallowing meat, or if you have ever met somebody that has a very hard time swallowing pills, that's usually because they still have the incorrect swallow. Another thing that we see with incorrect swallow is an open bite. When somebody smiles and this part over here is open, there's like a hole over there. Same thing, thumb sucking, pacifier, those are also called an open bite. But whenever they swallow, pretty much this is what they do. They also they push their tongue forward, okay? So that is the incorrect swallow. And that's something myofunctional therapists do. They work with the patient to correct their swallowing pattern. Or facial myofunctional disorder. So if you have these issues, these compensations, and some compensations can be positive, okay? So your body can find a way for you to breathe, for you to swallow, for your tongue to move how it's supposed to move, for you to speak, okay? There's tons of compensations in speech also that will not cause any issues. But some compensations can be negative. Some compensations can cause neck pain. Some compensations can cause development disruption, okay, where your face is not going to develop how it's supposed to develop. So oral facial malfunction disorders can include disruption in breathing. So if you're not breathing through your nose only, in and out of the nose. If you have a tongue tie, that's a whole other topic that I can talk about more on a whole different separate Instagram video. But tongue tie will keep your tongue on the floor of your mouth, because this tissue over here, and if you see on the picture that I posted today, this little part right there is called a frenum. If that frenum it's attached too close to the tip of the tongue, or it's too short, it can cause your tongue to stay low in your mouth around your lower teeth, and it prevents your tongue from moving and doing what it's supposed to be doing normally and correctly. So a lot of times people that have this tongue restriction, I don't even like to call it tongue tie, I like to call it tongue restriction. If you have this tongue restriction, you're going to use your lower jaw to do a lot of the movements as a compensation. A lot of the movements that you're supposed to be using just moving your tongue. So what do you think it can happen if you use your lower jaw a lot when you're not supposed to be using it? TMJ pain. So you might start having, in adults that come up to us, in the dental field also as a hygienist, come complaining of TMJ headaches and all of that stuff, and they wake up with this tired in the morning, all of that could be because they do not know how to dissociate their tongue from their jaw. They're supposed to move separately and differently. They have different tasks. So that's a myofunctional disorder. A speech issue is myofunctional disorder, which we dental hygienists don't treat. So if you swallow incorrectly, a lot of people swallow air and have tons of tummy issues. If you know somebody, whenever they are drinking something, really, that you hear the gulp, 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 that's incorrect swallow. What else? Like I said before, if children that are chewing meats and stuff like that have a difficult time swallowing, or certain textures or different types of food, or they swallow too early and they choke on it. Also, myofunctional disorders include poor tongue rest posture. So your tongue is supposed to live on the roof of your mouth. Suction like that, all the way up there inside your teeth. So if your tongue, and I already told you that, so I can't really ask you, it kind of messes it up if I tell you before, but if your tongue lives on the lower teeth or suspended in between the top and the lower teeth, that's incorrect rest posture. And that can also be caused by several things, but my functional therapist will help you with that. Disruption of the muscle harmony. So the correct pattern, muscle pattern for breathing, chewing, swallowing, and talking. If there's a disruption in that harmony, that's a myofunctional disorder. So if you don't treat those disorders, you're gonna see changes on your teeth. So you might have crooked teeth. You might see changes in your face, so asymmetry. If this side is smaller, larger than this side, crooked nose, one eye higher than the other. Most of us have some degree of asymmetry. And it's interesting, I have heard forever that the most beautiful people in the world have facial symmetry. The more symmetrical you are, the more beautiful you are. And it's interesting because those people developed correctly. Their face grew how it was supposed to grow. So, and that has to do with breastfeeding, that has to do with how you first introduce solids to the baby, and then the swallowing that comes with that, and the breathing. All of those things will help your face develop correctly. What else? This is just some extra info. How heavy? You guys want to know how heavy our human skull is? It's about, an adult human skull goes from 12 to 18 pounds. We are so heavy, it's like a bowling ball. So one thing that happens when somebody has breathing issues, a lot of times, in order for you to breathe better, you will put your head forward. I have that issue. And the reason why I went into this is because I had all these issues growing up. And when I first learned about this, I was like, oh my gosh, point by point, that was me. I went through all these things. But one thing that I've done and that people do, you move your neck forward, and what happens? Your head is so heavy. Crazy pain right here because of forward head posture, so I can breathe better. Okay, let's see what else. We have 22 bones in our head. 11 of those bones connect directly to the maxilla, which is this bone up here that houses your upper teeth. The other 11 bones do not connect directly to the maxilla, but they connect to other bones that connect directly to either the maxilla or the mandible, which are these two. The jaws, the lower jaw, and the bone that houses your upper teeth. And your nose. Did you know that? Roof of your mouth is the floor of your nasal cavity. So very, very related right there. During swallowing, we have almost 50 muscles that aid in your chewing and your swallowing. How insane is that? There's so many muscles working together. Chances are one of them might not work very well for one reason or the other, and then it's just a snowball effect. You get disruption in other areas of your life, and we can help see the issue and diagnose and treat that. So, as myofunctional therapists, we help our patients restore proper muscle function. Each one of those muscles working together to breathe, to talk, to eat, and to sleep, do what they're supposed to do to find balance. Baby's waking up right at the end of the live. Listen to that. So that's what we do. We help people breathe correctly, chew and swallow correctly, and it does affect all areas of your life. You know, if you don't breathe in and out of your nose, if you're using your mouth, you're gonna have more allergies. You're gonna be more tired. You're not gonna have as much exercise endurance. There's so much that can go into it, but this live today is just to explain to you guys what myofunctional therapy is. I don't want to make this too long, and I might have a question. Let me check real quick. Yes, whenever your nose gets stuffy on one side and the other. Yes, happens if you have a cold. And Zoe's calling me now. Oh, and Benny, everybody's awake. All right, time to go, guys. Thank y'all so much for being here. I really appreciate you watching this. Share with your friends. And stay tuned, because I will be making these often, talking a little bit about the world of myofunctional therapy, okay? Thank you. Have a wonderful night. Bye-bye.